the physician or other provider will come back into the room. And now when they come into the patient's note, there will be some additional BPAs or best practice advisories. There will be 4 that will show up. 1 for depression screening. It will include the PHQ-9 total, if it's positive. It will also have some recommendations based upon specific intervals. In this particular case, the PHQ-9 total is indicating mild depression with an intervention, a brief intervention, and consideration for medication. Had the PHQ-9 score been higher, it would have made additional recommendations.
Looking at the information that you provided from the screening that you completed with Nancy today, it looks like there's some degree of stress and worry in your life, and that there's been some alcohol use.
Okay. In this particular case, the patient did screen positive for depression, and the provider would like to go ahead and initiate some treatment. They can come into the order section and they might want to do a referral to a behavioral health team, and they can order that. It will also end up sending a message to the office staff to make sure that that referral gets done. They could additionally start prescribing some medication at this point and send that in to the patient's pharmacy. Lastly, the provider is going to make a suggestion to this patient that they come back on a short interval for close follow-up in 2 weeks. They can send a message to the staff at the checkout desk. Please make sure that this patient has a scheduled appointment with our behavioral health provider before leaving the office today. That will make sure that that referral gets done and the patient has an actual visit date scheduled.
So I have this colleague in our practice, Dr. Kessler, who likes to work with folks who aren't getting quite the results they like to get. So he's an expert in how mood and things like alcohol and stress can affect a person's health and medical conditions. And I'm wondering what you would think about having him come and sit down with us, talk with us briefly about how things are going and how your thoughts and behaviors might be affecting your health. What would you think about that?
Well, if you think it's the best choice to do, then
yeah,
we could do that.
Okay. Well, I do. I think it would be good to get another point of view.
Okay.
If I know that this patient is going to be seeing my colleague, Dr. Kessler, I can send Dr. Kessler, our behavioral health specialist, a message. Roger, please help with additional diagnosis, cognitive behavioral therapy, Dr. Kessler will then get a copy of my notes today in his electronic in-basket as well.